So I was essentially say if you're living the average American lifestyle, where you're typically very sedentary and you're not sleeping enough and you're highly stressed out and you have a lot of exposure to environmental toxins, and you're eating a standard American diet, you should expect yourself to potentially develop a cancer. Hey, my name is Dr. Clayton Bell. I am a functional and integrative medicine physician here at Forum Health in Asheville. I have a specialty in integrative oncology, as well as environmental medicine, functional medicine, integrative medicine, those kind of things. See a lot of folks with colorectal cancer, so I'm super, super excited to be here with my colleague, Dr. Bill Epperly. And Dr. Epperly, please.
Yeah, thanks a lot, Clayton. Yeah, I'm Bill Epperly. I've been in practice for almost 40 years now and have been in functional medicine for about 25 to 30 years of that. And I think today's topic about colon cancer and why it's going up and how we can stem that tide, I think is an excellent topic to cover. In my practice, we don't see as many cancer patients as Dr. Bell does, but we see a lot of patients with chronic illnesses that are really best dealt through a functional medicine approach as opposed to just one medication after another. So that's kind of what we focus on. So why don't we go ahead and get started? Dr. Bell, I'd like to ask you a question to start us
Sure.
off. So, recent studies have shown that there's a rise in colon cancer amongst young adults. And why do you think that this is happening?
Yeah, I think it's a great question, Bill. Honestly, I think it's multifactorial in nature. One of the top reasons is because, I think our environmental exposures now are much greater than they have been in the past. Also, in addition to that, too, our diets are radically different than they were 100 years ago, 200 years ago, 300 years ago. And even now, there's different populations of people. For instance, if you look in certain African countries, people that still have more of a hunter-gatherer diet and people still living more in these native indigenous cultures, colorectal cancer can sometimes be almost non-existent there. Whereas here it's extremely prevalent, and as you know, it's increased almost 10% in young people, even in the last at least 5 years, according to the American Cancer Society. And so I think part of this is our fast food culture. The foods that we eat tend to be super inflammatory. A lot of times they reside in the colon for a long period of time and begin to putrefy. As you know, we are an omnivorous species, and sometimes we can overconsume foods that don't pass the GI tract quickly, especially meat products, and we know there's a risk with, say, processed meats, red meats, these kind of things, with colorectal cancer. So I think we're just eating too much of the foods that are not ideal. We're not eating enough of the good foods like the vegetables and the fruit to pass this through our bodies, like fiber. And then that in combination with all the toxins in the environment, I think it kind of creates the perfect storm for our younger population to develop these chronic diseases that normally weren't seen until 70s and 80s, and then honestly weren't seen at all, several hundred years ago.
Right.
So I know it's a long-winded answer there. So I have a question for you now. So are there any specific symptoms or signs that you might see in a patient that's a red flag to you, and you're thinking, okay, I need to do an earlier screening than, say, the colonoscopy that's typically recommended for people in their middle-aged adult years?
Sure. Yeah, well, the thing about colon cancer that can make it so deadly is that it can get pretty advanced without any symptoms at all, which is why we really emphasize regular screening. And we know that genetics plays a role too. So if you have a strong family history of colon cancer, that would uh, tell us that we need to screen you sooner with some type of screening. Now, obviously, symptoms could be really anything. Blood in the stool was probably the biggest one and the most obvious one. And it can be a little bit of blood or it could be a lot. Um, but sometimes it's blood that you can't even see. You can only detect with some kind of a special test that detects hidden blood. But certainly symptoms of, GI discomfort, bloating, pain, cramping, diarrhea, a change in bowel habits in general, one way or the other. All of those can be signs. And the other thing is that colon cancer is also more common in people who have chronic inflammatory bowel disease. So whatever symptoms of that you have could also be a tip off that you're at higher risk. So, but again, the thing about colon cancer is you can be developing pre-cancerous lesions or cancerous lesions and not even know it, which is why we're talking about doing screening at an earlier age. So let me ask you, I touched a little bit about this in that answer, but what do you feel are the primary risk factors for colon cancer and other gut conditions and diseases?
Yeah, great question, Bill. And I think you mentioned some of them. If someone has a strong family history of, colorectal cancer, obviously that's going to be a red flag. There is a really rare genetic condition called Lynch syndrome. And if someone has that, they typically know because they have a super, super strong family history. Like, for instance, everybody in their families had colorectal cancer and they get genetically screened for that. And so if that's the case, then obviously we want very intensive testing, but also people that have had a history of polyps, because there's certain polyps that are precancerous or predispose us. So if you've gone in for, let's say, a previous colonoscopy and you had 2 or 3 polyps, then yeah, you're more likely to have cancer develop. So those are things to be aware of. In addition to that, I think, kind of like you mentioned, if people have like an inflammatory bowel disease, if you're prone to chronic constipation, like I said, that's a concern because, sometimes the food's getting there and putrefy and there's a lot of inflammation that occurs in the colon. And as we know, inflammation is a predisposer to many things, including multiple types of cancer, cardiovascular disease, strokes, et cetera, et cetera, et cetera. So I think all those things are risk factors as well. And then, honestly, let's just be real. If you eat a really, let's not call it a bad diet. Let's say if you eat the standard American diet, um, you should expect to get, you know, potentially cancer, a heart attack, stroke, diabetes, high cholesterol, hypertension, um, maybe depression from neuroinflammation, all these things. And that's not like a moral issue. It's just an action reaction. It's just that when we eat these near food products that are highly inflammatory and processed with tons of sugar and lots of other chemicals, and when you flip the package over and you can't even read the names of these things, um, yeah, we're going to develop physiologically a lot of these diseases such as colorectal cancer down the line. So I essentially say if you're living the average American lifestyle where you're typically very sedentary and you're not sleeping enough and you're highly stressed out and you have a lot of exposure to environmental toxins and you're eating a standard American diet, you should expect yourself to potentially develop a cancer in your lifetime. One in 2 men, 1 in 3 women are going to get cancer anyway. And so if you fall into the norm, yeah, you should expect you're going to get cancer. So I'd say you really want to be an outlier, kind of a rebel against the norms of society to try to decrease your risk of getting
Right.
cancer. Um,
Absolutely.
yeah, so and I talked about diet a little bit already too, but I'd like you to expand upon that. What role do you feel like diet plays in the prevention of colorectal cancer and gut dysfunction in general? You mentioned inflammatory bowel disease previously too. So, Bill, are there any specific foods or dietary patterns you would recommend to say all of us so we can avoid this?
Yeah, definitely. And the interesting thing is the diet that helps to reduce your risk of colon cancer is the same diet that helps reduce your risk of all the other chronic diseases that people get pretty much. So,
Right.
so the kind of diet we want to be eating is one that's the food that God made. There's a guy named Tom Ziegler who wrote a little blog and he called it the purity diet. And he said if God didn't make it, don't eat it.
It's a good
And
rule
I
of thumb.
love that. I share that with my patients. So, a whole foods diet, particularly a diet of fruits and vegetables that are very rich in color. So things like blueberries and kale and purple cabbage and strawberries, anything that has a lot of color, like orange and red peppers and yellow peppers. So those are the kinds of things that are high in antioxidants. That's what those colors represent, are antioxidants. And antioxidants are important because our bodies are always under something called oxidative stress. And you have these little chemicals in there called free radicals, which are just there to disrupt cell function and cell components. And so the antioxidants in a food are responsible for counteracting those free radicals. And so those foods that I mentioned are rich in these antioxidants. The other thing in the diet that's important is fiber. So it can be, and there's two kinds of fiber, soluble fiber and insoluble fiber. Some people think of fiber as sort of like scrubbing the intestines, and that's probably an overstatement, but it's a good word. It's a good picture, to think about, kind of cleaning out your colon. But fiber also plays a real important role in supporting the health of the microbiome. The microbiome is the population, the trillions of bacteria that live in your gut, which play a huge role in gut health. So the diet that's rich in soluble and insoluble fiber helps to support that microbiome. So that's the kind of food that you want to eat. So a lot of fruits and vegetables, beans and greens, seeds and nuts. These kinds of things would be very important. And another thing that we know about diet that we sort of extrapolate from what we know about certain populations that have a very low cancer risk of colon cancer is a diet that's rich in spicy foods like chili peppers and
Hmm.
curcumin or turmeric. These sort of hot spicy foods have sort of a, I guess, an anti-inflammatory effect on the lining of the intestine. So countries that eat a lot of these hot spicy foods tend to have a lower cancer risk, and we think that there's an association with that. So yeah, I think that's pretty much all I can think of as far as like major dietary factors, and getting the junk out, of course, the chemicals, right? And I think you made a good point that you look at a label and you can't understand what those chemicals are. That's probably a sign that you shouldn't be eating that food. In fact, one of the things we say a lot in functional medicine is if you have to read a label to see what's in a food, maybe you shouldn't be eating that food. So that's another dietary guideline that could be helpful. So, so besides diet, Dr. Bell, what do you think are other lifestyle factors and preventive measures that people can take to reduce their risk of developing colon cancer?
Yeah, absolutely. I think it's a great question. So often people come in and we tend to be hyper focused on one thing, right? And that tends to be, what we saw in the media recently or what we're trained in. And I think you covered the nutritional aspect of that beautifully. Very, very good. So, like you just said, that anti-inflammatory, Mediterranean-oriented, plant-heavy diet is perfect. But in addition to diet, what a lot of people don't realize too, let me just start with stress, right? Because when people are chronically stressed out, that suppresses their white blood cells and their natural killer cell function, and that suppresses their body's natural ability to fight off any type of infection or cancer. So being chronically stressed is going to leave you vulnerable to developing COVID, um, EBV activations, autoimmune diseases, the cold, influenza, and every other type of cancer as well. It's nondescript, so you never know what you're going to get from the chronic stress component of that. And that's something that I think is just so prevalent in our society too. Especially like look at us in our medical community. I mean, how many colleagues do you know that have developed cancer throughout their career? But it's like, a lot of people I see in the professional fields too. It's like all of us for that matter. We're trained to be very achievement oriented. We're conditionally reinforced for having that behavior. And then there's really not a lot of emphasis on relaxation and restoration in our society unless you have a personal practice, be it meditation, prayer, journaling, art, physical activity, what have you, to really kind of balance your nervous system out. So when your body's in a constant state of essentially sympathetic overdrive or that fight or flight, which is wonderful for getting degrees and getting things accomplished and making all the deadlines, and maybe you're a dad and you work, and you're trying to work out, and all these kind of things. It's kind of like we're robbing the piggy bank essentially. And so I think that chronic stress component really really leads into it. From This is a little bit more esoteric in nature, but kind of playing upon that from a more energetic, esoteric, psycho-emotional standpoint, a lot of physical manifestations begin, in the mind or in the emotional state, and they eventually manifest themselves in a physical basically manifestation in the internal state. And colon cancer, a lot of times I'll actually see that with men that have a lot of essentially constipated emotions, if that makes sense. Um, because and part of that I think is the nervous system, right? Like they're not really processing the emotions. I know I've struggled with chronic constipation. And it's always a psychological state where my body's just so ramped up. It's just I'm holding on to everything and I'm being controlling and I'm tight and I literally can't relax to let natural things go. But I'll see a lot of men that come to my clinic, and this is not everybody, right? But a lot of people that I'll see with colorectal cancer, they have literally like it's almost like their emotions are stuck. They're not releasing them. They're not letting them move through the body. And so, like I said, that's a little more esoteric and that's a little bit more outside to say the medical books. But clinically, that's something that I definitely see. And I think it's something that we need to approach with any kind of cancer diagnoses, because that those long held emotions that we're not processing or not allowing ourselves to feel, can ultimately manifest themselves in that chronic state analysis, which can lead downstream um, to things like chronic inflammation, nevertheless, suppressed immune system, so on and so forth. So that's one of them. Sleep is another one, and there's a great book, it's by Matthew Walker, called While We Sleep. He's a PhD over in California. But it's a great book, and it really covers a lot about cancer too and the benefit of sleep. But I mean, the most healing time we have in our lives is when we're actually asleep. If you want to get better, get healthier, get stronger, it's not when you work out or any of those things. It's when you're sleeping. That's when you recover. And so
Right.
many of us are sleep deprived, and it's become a badge of honor in our society, whether it's in the medical field or like, the Silicon Valley culture or what have you, military, whatever. It's like, I don't need sleep. It's like, yes, you do. If you think you don't need sleep, you're essentially operating basically the same as being mildly intoxicated. But your immune system is not as responsive. You're way more likely to get multiple types of cancer, those kind of things. So I think lack of sleep is huge. Lack of physical activity is another big one we talked about as well. If you're very sedentary, that's gonna be more predisposed to add more weight, which is going to cause more inflammation, and then also you have peristalsis in the gut's going to slow down, so you're not moving these things out of the gut. And then the fifth component, I think, is just toxic exposures, which I see a lot, and they're very, very prevalent in our society, whether it's from food that we eat or, the water supply or what's in the air, and how close you live to the road. EMFs, we're learning have more health detriment than we realized previously. So I think that combination of those five things are really the foundation of our health, and colorectal cancer can be a consequence of a disequilibrium in those as well. So long answer to your question there, Bill, but I think it's really important to cover all those as well. So my turn to ask you a question now. So I think I was going to ask you about fiber, but I think you nailed that one perfectly well. And then we spoke a little bit on genetics and family history as well. So if you want to elaborate a little bit more on that, you can. Uh, and then I'm also going to have you kind of lead into the next thing, which is how important do you feel like early screening is for colon cancer, especially in young people? And then you kind of alluded to this earlier, but we didn't hear exactly what methods you were talking about. So can you tell us a little bit about which screening methods you recommend to your patients?
Sure. Yeah, absolutely. I'm going to circle back just for 1 second. What you said about toxic exposure. It just, as you were
Mhm.
saying that, I was thinking about how I was filling up my gas tank on the way to work this morning. And even something as simple as how close you stand to the
Mhm.
gas pump while the gas is pumping. And do you stand upwind or downwind from it? Are you inhaling those gas fumes
Sure.
or not? So it just kind of remind me of that. So there's a lot of little things like that that happen in our
Mhm.
lives where we get exposed to toxins, where maybe we can mitigate that with some simple adjustments. So, but yeah, in terms of genetics, I'm not a great geneticist and per se, but yeah, definitely just family history in general. And you did allude to something earlier with the Lynch syndrome and the higher incidence. So I would just say, in general, a strong family history is going to give you kind of a red flag warning that you need to be more careful about screening and actually be more diligent about your diet and things like
Mhm.
that. And uh, and before we're done today, I want to go back to also to one other thing about diet, which I found interesting, but we'll talk about that in a second. As far as screening goes, so there's basically 3 or 4 different ways that people can get screened for colon cancer. Now, in the olden days, we used to talk about sigmoidoscopy, right? And in fact, it was a standard method to check something called stool for occult blood or a hemoccult, where you would take a little bit of stool and smear it on a little piece of paper and then put some chemicals on it. If it turned blue, then you had blood in your stool. And they can still do that, only that test now is more sophisticated. There's something called a second generation fit test, which again is you take a little stool sample and you put a solution on it and you look for a color change. And that's actually something you can buy at Walmart or online. It's called the second generation fit test. Fit stands for fecal immunochemical test. And it's a pretty sensitive test for blood in the stool. And the reason that's important is that malignant lesions or even pre-malignant lesions can bleed a little bit, but not so much that you necessarily see it. So it's looking for hidden blood in the stool. So that could be an early sign. Now, that's not a real sensitive marker, but at least it's something, right? So it's a good place to get started. And you can actually do that every year or twice a year if you want. And then you could combine that with a sigmoidoscopy, which is basically just looking about 60 centimeters up into your colon. It's not really far enough, but it does look at the area where the majority of colon cancers tend to be, but it doesn't look at the entire colon. But it's a much simpler procedure than a colonoscopy. So everybody knows what colonoscopies are, and a lot of people don't like to do them. And so for patients who are really avoiding doing a colonoscopy, I will also offer them a test called a Cologuard. And a Cologuard is a somewhat new test. It's a DNA-based test where they check the stool for DNA related to colon cancer or pre-colon cancer, pre-malignant polyps. So it's a pretty good test. In fact, it's so good, it's only 2% less sensitive than a colonoscopy. Colonoscopy is somewhere around 95+% sensitive, which means how many times it can pick up a cancer when it's actually present. The Cologuard is only 2% less sensitive than a colonoscopy. So it's really a good test. They recommend that you do it every 3 years, however, instead of every 5 to 10 years. And Medicare will actually pay for that, and a lot of insurance companies will pay for that. So that's a pretty cool test if you really don't want to do a colonoscopy. But then, of course, colonoscopy is still the gold standard for testing, and that requires, altering your diet for a couple of days and doing a bowel clean out and then going and to the place and going through that whole thing. So those are basically the screening methods. Now, one thing I will say, going back to the Cologuard, the Cologuard actually consists of two tests, and the company doesn't really tell you this, but the two tests are the FIT test, which is the first one I mentioned, and the second one is the DNA test. Now, if either one of those is positive, it's considered a positive test. Now, what I tell people, by the way, if either one of those are positive, then you have to have a colonoscopy to see what's going on and to take any polyps out that are present. But the thing about the Cologuard is that if the FIT test is positive, the whole test will be positive. And so what I tell people is before you do Cologuard, do the FIT test first, because if that's positive, you don't need to pay the whatever hundreds of dollars for the whole Cologuard. You can just pay $25 for the FIT test. And then if that's positive, you have to have a colonoscopy anyway. So that's a little tweak testing, that they don't tell you. So I kind of let patients in on that little secret, especially if their insurance isn't going to pay for the test. So just do the FIT test. If that's negative, then go ahead and do the Cologuard if you don't want to do the colonoscopy. So again, that's a long answer to your question, but that's what I would recommend.
Answer.
So let's see. So let me ask you a question. So
Sure.
how do you, as a functional medicine provider, approach the prevention and treatment of colon cancer differently from conventional medicine?
I think it's a great question. Because I think we all started off in more conventional medicine. Like I was trained in family medicine. Then I went to do a fellowship in integrative medicine because I really wanted to learn the science behind lifestyle, particularly nutrition, and the impacts it had on health. And you know, with the functional medicine, with the integrative medicine component to it, I really feel like we offer so much more than just pharmaceuticals. Don't get me wrong, I use pharmaceuticals as a tool, 100%, absolutely, as needed, but it's not the go-to, it's not the first line therapy. I mean, so for me, I'm really utilizing someone's lifestyle to help prevent colorectal cancer on the front end versus being reactive when someone develops it. So, and like you said too, it's interesting because the diet that helps with colorectal cancer is also the diet that helps with heart attacks and strokes and all that. It's the same thing. When we're doing lifestyle modification and recommendations for people, I'm not targeting their colorectal cancer unless that's just a concern for them because of family history, what have you. I'm just looking at them as a person and their overall health. And you know what? Colorectal cancer prevention is going to be done through this mean. And really, it's going to be optimizing things that we talked about, as far as lifestyle, as far as nutrition, physical activity, stress resiliency, sleep, minimizing toxins in the environment. Another thing I didn't mention earlier too, that can increase risk of colorectal cancer as well as many other cancers. And I know people are aware of this, but sometimes when we're engaging them, then we forget the impact they have on our health. But that's going to be both smoking and alcohol consumption.
Absolutely.
And yeah, and I know with smoking, I mean, I think we all know now, like when I was a kid, it was even more prevalent. I know, Bill, when you were younger, even before that, it was even more socially accepted. When I was in college, I used to smoke. So it's not, like I said, once again, none of these are moral things. But as far as for your health goes, it's definitely a no bueno. It's no good. It's hard to make any arguments for the benefits of smoking. With alcohol, there's definitely been some, I'd say, marketing towards cardiovascular health for alcohol, and you can make an argument for that in very small doses. Um, that being said, when it comes to cancer, anything in the GI tracts, you can think about mouth, esophageal, stomach, colon cancer. There's unequivocally that alcohol is going to increase risk of developing those cancers. So
Mhm.
if you want to drink alcohol, just do it for fun. Just say I like alcohol and I want to drink, and that's cool. That's fine. Just like eating a brownie. Don't eat a gluten-free brownie pretending like you're being healthy. Don't drink alcohol pretending like you're being healthy. Just drink alcohol because you like it. But don't do it to prevent health problems or to save your heart health or any of those things. And I think that plays into like, kind of cancer prevention and that. So once again, I'm not a teetotaler. I'm not advocating people never ever drink. I'm just saying when you do these actions, any kind of recreational chemicals, whether it's caffeine or alcohol or tobacco or anything else you might engage in, plant medicine per se, just do it with honesty, within your mind, body, and soul, and knowing that things like smoking and alcohol are not going to serve you in the health capacity. Um,
Mhm.
uh,
Right.
all right, and then so my turn to ask you now, Dr. Epperly, if you could please give the audience one pearl, one takeaway point above all the other ones to prevent colon cancer and to improve their overall gut health, what would that takeaway be? And it's fine with me if you want to expand to two or three, but I'd really love to hear what your main takeaway point. If people don't listen to anything else in this and they only get the snippet right here, what's the main thing?
It's going to be a four-letter word that people don't like very much, and it's diet.
Okay. Ah,
Diet, diet, diet.
the D
And
word.
but there's the D word that people don't know. But everybody's on a diet, whether they like it or not. The question is, it is a diet that promotes health, or is it a diet that's anti-health? And I will expand on that a little bit. I talked about fiber. So
Hmm.
fiber, color,
Hmm.
and then what I wanted to add to that, which I forgot to say earlier, is cutting out refined carbohydrates,
Hmm.
i.e., sugar, corn syrup, white flour. In fact, flour of any kind should be minimized, but flour in general, because that flour has what's called a high glycemic index. So, what is that? So, glycemic index is the number that's given to a food that denotes the degree to which that food raises your blood sugar. And why is that important? Because when you raise blood sugar, you have to make more insulin to control the blood sugar. So that can lead to what's called insulin resistance or hyperinsulinemia. Insulin is a pro inflammatory hormone and it causes you to store fat, which makes things even worse because if you get more and more visceral fat, which is fat inside your belly, that creates more inflammation and more insulin resistance. So it's sort of you know, a snowball effect. It just gets worse and worse. So diet, diet, diet to which should be low glycemic, high fiber, high color. And one interesting thing too I wanted to point out is that there is also research about the effects of insulin on colon cancer and other cancers. So because of its pro-inflammatory effect. So not only is the fiber an issue in terms of how diet affects you, but also the diet's effect on insulin levels and inflammation. So I just want to point that out. So yeah, diet's the word, man.
I like it. And I'm going to piggyback on one thing you said there regarding the insulin. When we do a lot of our advanced cancer testing, what we often find when we isolate the circulating tumor cells and look at their genomic, basically, drivers of their tumor, what we find a lot of times is that insulin-like growth factors are actually perpetuating and driving their tumor growth as well. So once again, it's the inflammation from the insulin as well as insulin actually being an active fuel source to the receptors of the tumor cells to perpetuate them and increase them as well. So I just think that some people probably don't know. So another good reason to eat that lower glycemic index, lower glycemic load foods.
Right. Well, those are all the questions I have. So I think we've come to the end. So this has been a great discussion. I certainly have learned a lot already. So we're always learning, right?
Always, every day. Yeah, I'm always learning from my patients, learning when we do things like this. But we had talked about this kind of offline before we started and everything. But the question was, well, should we expect these rates to continue to increase in the future? And I mean, unless something radically changes in our society, based on the choices we make in food, the food that's available to us, because a lot of people live in these food deserts. And I mean, the primary determinant of someone's health is actually their zip code. It depends on, do you live in Aspen or Vail in Colorado, right? Where good food's abundant and everybody's physically active, you have a cleaner environment, or do you live in maybe some of these urban food deserts, or do you live where your micro society, your micro bubble, it's just everybody eats fast food and that's what they do. And so those kind of things are going to have a huge impact on our health in generations to come. And in addition to that, too, the toxins in our environment, unfortunately, not to be a doomsday at all, because I think a lot of us are being very proactive and trying to be more conscious and live in a much better balance with Mother Earth and what have you, and kind of return to a lot of the ways the indigenous societies and tribes have done it for millennia before kind of the Industrial Revolution and so on and so forth. But our world is just becoming more and more toxic, and like I said, that's not to be negative. That's just stating the obvious. And as this happens, we're going to continue to see a lot more cancer and a lot more autoimmune disease and other things too. So, I mean, not that I want to be busier, but I mean, I think all physicians in the functional medicine field have a lot of job security because until things radically change in our society, more and more patients are coming to see us that aren't getting the answers they're looking for from their traditional medical care, and these disease states are becoming more prevalent. And the sad part to me that really breaks my heart is even when people are doing their very, very best, they're making their best dietary choices, and they're trying to keep their stress levels down. They're trying to get sleep, and they're just trying to basically take care and provide for their families. With the huge allostatic load on us from a psychological, emotional, physiological state, we're still developing these cancers. And that's when we're doing everything right. So, I think it really behooves us all to try to be as proactive as possible. And then if you do develop this, or if you want to prevent this, go see a Dr. Epperly, see myself, see someone else in the Forum Health Network, or another, IFM certified practitioner, what have you, that does functional medicine, and, allow us to be a navigator or kind of a guide to help you to reach your ultimate health goals and prevent these things. Because, as we talked about, they're way easier to prevent on the front end. Because once you get them, and especially a lot of times when people come see me, they're already stage 3, stage 4. We have so many fewer options than if people are stage 1 or stage 2, or better yet, they're precancerous, or they don't even have it yet. It's so much easier. So please be proactive with your health. I guess that's kind of my takeaway point. And, know that you are empowered and you have essentially the primary control of how healthy you're going to be in the decades to come. Like I know Dr. Eppley and I, last time we went to our big Forum Health conference, we met for breakfast and he's wearing his workout shirt. He's already got his workout in at 6:30 in the morning, and so I know how he takes care of his body. And I saw the way he eats, so he's walking the walk. So, Bill, it's a pleasure doing this with you. Thank you so much for the
You too.
opportunity, and hope everybody out there gets something out of this.
Yeah, absolutely. I would agree. And this has been a pleasure to have this conversation with you. And I look forward to doing this, again in the future. So, yeah, hopefully this has been helpful for people listening and can lead to some, more positive outcomes for them.
Hi, Dr. Saxena here, Chief Medical Officer at Forum Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.